Welcome to Stroger Hospital's training module number 11, the 10-step process for cleaning the patient ISO room after the patient has been discharged. We are happy to provide this information training to you, and we are glad that you have taken the time to participate in this training module. Let's begin.
At Stroger Hospital, we believe that thorough environmental cleaning and disinfection is crucial to the health and well-being of patients, guests, and staff. As such, it is vital to understand the importance of environmental cleaning and disinfection of patient isolation rooms. Our goal is to remove the contamination of microorganisms from surfaces and equipment where patients receive care, in order to minimize the risk of disease transmission and cross-contamination. While we perform this important work, our goal as environmental services employees of Stroger Hospital is also to be ambassadors of Stroger Hospital to the patients, guests, and staff who might be present while our work is being performed. In this training module, you will find that many of the cleaning processes and techniques that you've learned in training module number 10, cleaning the occupied ISO patient room, are the same or very similar to what you will be learning here in this module. The essential differences will be in the additional cleaning tasks we add because we are cleaning an ISO room where one patient has been discharged, and we are preparing it to receive occupancy from a new patient. Simply stated, we have more work to do in an ISO discharge room cleaning than in an occupied room cleaning. A summary of what we will be covering in this training module includes determining the correct personal protective equipment to wear, pre-inspection of the room for planning your work, safely emptying waste containers and removing trash, safely removing linens, such as sheets and towels, followed by training on how to thoroughly disinfect the bed mattress, side frame rails, headboard, and footboard, performing thorough cleaning because this is an empty discharge ISO patient room, disinfecting surfaces, especially what we call high hand touch surfaces, spot cleaning surfaces, cleaning and disinfecting the patient restroom, dust mopping the floor, performing final inspection of the ISO patient room, and finally, damp mopping the floor. Now, before we dig into the details of the ISO room discharge cleaning, remember that there may be other members of the Stroger Hospital medical team who are also performing their duties for the preparation of the room for the next patient coming in. Be polite and professional by coordinating your work with your coworkers from other departments of Stroger. Remember your role as an ambassador for the Environmental Services Department of Stroger Hospital.
Determine the correct personal protective equipment to wear. Before any cleaning work begins, make a determination of the correct PPE you must wear prior to entering the ISO patient room. The first step in making this determination is to observe whether the room is under negative pressure. You do this by checking the negative pressure indicator mounted on the wall above the ISO room entrance door. If the indicator shows that this is a negative pressure ISO room, then look for PPE precaution signs posted outside of the patient room. There are 3 types of precaution signs: droplet precautions, airborne precautions, and contact precautions. Each type of precaution specifies the type of personal protective equipment you must wear. Follow the PPE requirements and instructions exactly and completely. If no precaution sign is displayed, then assume that you must wear the standard PPE of a Stroger uniform and vinyl gloves for your hands.
Start by positioning your cart properly next to the ISO patient room door opening, but do not block the doorway with your cart. Next, knock on the patient's room door and do so even if the door is already wide open. This is a polite way of announcing that you are coming in and also asking for permission to enter. Since this is supposed to be a discharge ISO room, there should not be a patient inside. Sometimes a mistake in scheduling can be made, however, so don't just assume the room is empty. Wait to hear a response before entering. If you do not hear a response, knock again. If you still do not hear a response after the third knock, enter slowly, being careful to listen and to look for the presence of a patient or some other person in the room. If no one is in the room, you may begin your work and assume that this is truly an empty ISO room that the patient has been discharged from. If there are other medical staff teams working in the room, say hello and introduce yourself with a smile. Coordinate and plan your work around the work being done by the medical staff to allow for smooth teamwork in efficiently preparing the ISO room for the next patient. Note, the door to the patient isolation room must always be kept closed. Enter and close the door behind you. Never leave the door open.
Place a wet floor sign outside of the room. When placing the wet floor sign at the entrance to the ISO room, be careful to not block or minimally block entrance to the room with the sign. The sign needs to be visible, but should not be right in the center pathway of the walking lane into the room.
Your next step should be to inspect the area before pulling out trash from the waste containers. This is to determine which portions of the ISO room need special attention and allows you to plan your work efficiently. This step also lets you gather loose trash and place it in the waste basket before pulling the trash from the cans. As you should know from your Stroger Hospital safety training, it is important that you keep biohazardous waste located in the red trash cans with red liners separate from regular waste. Never mix the two together. Last thing, when you inspect the ISO room or as you are performing your work, you may find personal items that were left behind from the previous patient. If you do, gather these items and turn them into a member of the medical staff so that they can be returned to the patient.
Be safe. Avoid pokes from needles and sharps. If there is a large amount of waste in the receptacle, do not use your hands or feet to compress trash. Never compress trash with hands, feet, or any other part of your body. This is to prevent injury from loose sharps that might have been improperly disposed of. When pulling trash, gather trash liner at the upper edges and tie the liner closed. Lift waste liner slowly out of the receptacle, keeping it away from your body. Never let the trash liner filled with trash bump up against your legs or any part of your body, carrying the trash to the designated container. Before replacing the trash liner with the new clean liner, wipe the interior and exterior of waste receptacle to disinfect and to remove any spills, drips, smudges, or fingerprints.
Removal of soiled linens. Like pulling trash, the removal of soiled linens must be performed with good attention to safety so that you avoid accidental cuts or pokes from sharps that may have been improperly left in the folds of the bed sheet, towel, or other linens. For the removal of bed sheets, start at the far corners of the bed and pull the corner of the sheets into the middle of the bed. Do this for each of the 4 corners. When you pull the corners to the middle, grab by pinching the farthest edge of each corner with your fingertips. Do not grab sheets or other linens with a closed fist, compressing a bunch of the material into the palm of your hand. Also, once you pull the corner to the middle of the bed, let the corner drop out of your fingertips into the middle. Do not push the sheet down onto the bed with your hand. If necessary, you can repeat this process folding the farthest corners into the middle. Use your fingertips. Let the sheet corner drop to the middle, but do not compress. When you have finished folding the corners in, you will have a small bundle of sheets. Again, using fingertips only, pick the bundle up by your fingertips, minimizing the amount of the linen material that you touch with your hands. Once you pick up the bundle of sheets, do not shake the bundle. Always carry it gently. You should use a similar process for gathering towels, specifically being safe and carefully watching out for needles or other sharps that may be hidden in the folds of a towel. Always handle the towels and other smaller linens with your fingertips. Fold into the middle and do not shake out towels.
Place soiled linens in the blue bag soiled laundry container. Let the soiled linens drop in and fall into the bag under their own weight. Never compress the linens into the bag by pressing them down with your hands or any other part of your body.
Always start dusting by first high-level dusting, then work your way down. Because this is an unoccupied discharge ISO patient room, now is the time for you to perform a more thorough dusting, especially around the areas that needed to be avoided when the room was occupied with the patient and guests. Two of these critical areas are the ceiling and wall vents. Remember that most ISO patient rooms have a wall vent above the patient bed, a ceiling vent located in the ceiling, and a door vent located in the lower portion of the main patient room door. When high dusting, take the microfiber duster and the extension tool and dust shoulder height or higher in the area. Dust the walls, ceilings, vents, ledges, furniture, fixture vents, and the wall area around the vents. Dust windowsills, baseboards, and chair rails. Generally, you need to look for the dust accumulation on any horizontal surfaces that can catch dust, and make sure that you thoroughly clean it off.
Sanitize all horizontal surfaces and all high hand touch surfaces. Note: always check if an ISO room is designated as a C. diff case. If so, use cavi wipes for your sanitation cleaning. If not a C. diff case, you can clean with neutral disinfectant cleaner. Sanitize all horizontal surfaces with an emphasis on what we call the high hand touched areas. High hand touch areas are surfaces that get a lot of hand traffic. If you look around the room, you can see what the high hand touch surfaces are. Examples include doorknobs, light switches, bed rails, chair rails, patient food tray tables, telephones, TV remotes, nurse call buttons, cabinet pull or push knobs, and counters. Sanitation or disinfection cleaning is accomplished by applying neutral disinfectant cleaner to the surface, and remember, you must allow for the necessary 10-minute wet dwell time for the disinfectant to kill germs, so follow this process. Apply the neutral disinfectant cleaner. Allow it to sit 10 minutes wet dwell time. Wipe clean using the appropriate wiper. Use a blue wiper when cleaning in the patient room. Use an orange wiper when cleaning in the patient restroom. Leave the surface in a clean and streak-free condition.
As an important step in cleaning and sanitizing all horizontal surfaces, special attention must be made in thoroughly cleaning and disinfecting the ISO room patient bed. You should have already stripped the bed of all sheets and linens. If you have not, perform this task before any bed cleaning starts. Now, with sheets removed, all surfaces of the bed must be cleaned and disinfected. Utilizing the neutral disinfectant cleaner, start by cleaning the headboard and footboard of the bed. Clean the side rails. Then move to the cleaning of the mattress. Clean both sides of the mattress pad, as well as the side surfaces of the pad. Move the pad to one side and clean the hard surface platform that the pad rests on. Move the pad to the other side and repeat this process by cleaning the hand surface below the pad. Now, use the electric controller to raise the bed up into the upright position. Begin cleaning the underside of the bed that is exposed by raising the bed up. Thoroughly clean surfaces and in all cracks and crevices. Moving downward, clean the lower surfaces of the bed, including the lower sides of the pedestal stand and the back and front, all the way down to the level of the floor. In all cleaning of the bed, allow the required 10-minute wet dwell time for the neutral disinfectant cleaner to eradicate all microorganisms. Once all surfaces have been cleaned, return the bed to the lowered, fully flat position. As your last step, clean the push button controller that you have been using to raise and lower the bed.
Spot clean all vertical surfaces. Vertical surfaces are areas such as walls, doors, door frames, and cabinets. Again, look for places on vertical surfaces in the ISO room where dirt, germs, splashes, or smudges can accumulate and focus cleaning attention on these places. Examples include the walls near or around the waste can can often get splashes or spills. Door push plates or door frames are frequently touched by hands and can have smudges and fingerprints that need cleaning. Cabinet doors can also have fingerprints and smudges and accumulate dirt. Spot clean vertical surfaces such as these using the neutral disinfectant cleaner and the appropriate wet dwell time to let the disinfectant kill microorganisms.
Cleaning the patient restroom. Prepare to clean the ISO restroom by placing the wet floor sign next to the restroom door. Next, high dust all horizontal surfaces in the restroom. For disinfection cleaning of the surfaces and fixtures in the restroom, make sure you are using the neutral disinfectant cleaner and orange microfiber wipers. Remember, orange for bathroom cleaning only, blue for room cleaning only. Remember also, on all bathroom surfaces, it is very important to apply the neutral disinfectant cleaner and allow the full 10-minute wet dwell time for the disinfectant to fully kill germs, viruses, and other microorganisms. Make sure to clean mirrors and dry with paper towel to prevent streaks. Clean the sink and the surrounding area, such as the counter, underside of the bowl, and piping under the sink. Make sure to spot clean all splash marks on the wall that may be adjacent to the sink, the toilet, and the shower. Clean the shower, starting at the top and working your way down, and being sure to scour the shower basin floor. Next, start disinfecting the toilet by first applying bowl cleaner into the bowl of the toilet and allowing it to sit 10 minutes or more. Apply neutral disinfectant cleaner to the rim of the toilet, to both sides of the seat, and to all exterior surfaces of the toilet, again allowing for the proper wet dwell time. Wipe all surfaces of the toilet down and leave in a clean and streak-free condition. When cleaning the inside of the toilet bowl, use a Johnny Mop to clean the inside and then replace the Johnny Mop in its carry container. Note, do not use toilet bowl brush or Johnny Mop on the outside of the toilet bowl or any other surface other than the inside of the toilet bowl. Remember to empty the bathroom waste can while taking all of the same precautions used in emptying the patient room waste can. For example, do not compress the waste. Do not let the full waste bag you have pulled from the can bump up against any part of your body. Wipe the waste can clean and reline with a new clean liner.
Refill dispensers for soap, hand towels, and toilet paper, then damp mop the restroom floor. But first, stop. Remember, you have just cleaned the restroom. Your gloved hands are contaminated with the microorganisms of the bathroom. Before you proceed to refill the dispensers and restock towels and linens, you must dispose of your gloves, wash your hands, and put on new clean gloves. Restock paper towels with the fold properly facing downward so that the towels dispense as they are intended to. Refill the toilet paper dispenser, refill hand soap dispensers, refill shower toiletries. Replenish bath towels, hand towels, washcloths, and other linens. As your final step in cleaning the restroom, damp mop the floor.
Dust mopping the ISO patient room floor. Always make sure you dust mop before damp mopping the ISO patient room floor. This excludes instances of obvious blood spill in the room, in which case it is appropriate to clean using the Stroger Hospital protocol for blood-borne pathogen cleaning as described in the Standard Operating Procedure and Training Module number 24. When dust mopping, make sure you work clockwise around the room and use an S-stroke while keeping the leading edge moving forward. Be sure to move any furniture and dust mop underneath. Make sure you dust mop carefully in corners, along edges, and on the baseboards. Be careful not to lift or shake the dust mop during or after use, as this will cause excess dust to be lifted airborne into the indoor air environment.
Final inspection before damp mopping. Before damp mopping, take a moment to do a final inspection of your work and make sure you have not missed anything. This is the time to inspect curtains and look for stains or portions of the curtain that might need repair. Be sure to check the sharps container and arrange for its replacement if it is filled to capacity. Remember, sharps containers are sealed for your safety and the safety of everyone at Stroger Hospital. Never attempt to open a sharps container. Double-check all soap and hand sanitizer dispensers to make sure that they are properly refilled. The same final check should be made to all paper product dispensers and all towels and linens. It is important that you check door hardware and metal kick plates to make sure that they have been properly cleaned. If any items in the room need repair, or any lights are burnt out, be sure to report this to your supervisor so a work order can be submitted to the Stroger Buildings and Grounds Department.
Damp mopping. Prepare to damp mop the ISO room floor by placing a second wet floor sign inside the room. You should have one wet floor sign outside of the room at the entrance and one in the room with both sides being highly visible to minimize the risk of slip and falls. Begin damp mopping the floor, working around the room using an S-stroke and paying special attention to corners and baseboards. Make sure to move any furniture and mop underneath. Make sure you mop behind the doors. If you find any spills or stains on the floors, on the baseboards, or in corners or edges that you cannot remove, report these to your supervisor. Before reporting this, however, make sure you have made every effort to remove the spot, stain, or spill yourself.
Final inspection before leaving the ISO room. Take one final look around the ISO room and the restroom to make sure that you haven't left any of your tools or supplies behind. If there are any other members of the Stroger medical staff still working in the room, let them know that you are finished, thank them, and say goodbye.
Thank you for your participation in Stroger Hospital's training module number 11, the 10-step process for cleaning the discharge patient ISO room. If you have any questions, please be sure to ask your supervisor.